Hi, my name is Mark Green, and today I would like to present my visual aid speech or my visual aid presentation entitled Prostate Cancer is on the Rise. In today's society, prostate cancer continues to be on the rise and affect the lives of many males. Prostate cancer is the most widely known and the most treatable of all types of cancer, but it is the #2 cause of death among males in the United States. It is even more prevalent among African Americans, who run the rate of 60% being diagnosed with this dreadful disease, that compared to Caucasians and Hispanic males. Cancer has plagued the lives of millions, and they continue to fight for their lives through this dreadful disease called cancer or prostate cancer. And it's even on course and on path to surpass the #1 cause of death, which is heart disease. Just this year alone, many have fought the battle and battled cancer and have succumbed to this dreadful disease. Is there any relief in sight? Today, I would like to share with you a couple of slides that I have, and it concerns prostate cancer and how it affects the livelihoods of males. The function of the prostate gland. The prostate gland is part of the reproductive system, and it is required for males to reproduce with semen. It is produced in the prostate itself. The location of the prostate is between the pelvic bones and just below the bladder, as you can see here. I have a larger illustration that I can show you here, which this is the bladder and this is the prostate itself. In defining prostate cancer, I want to define it in the simplest term possible. And the simplest term possible is cancer is called a malignancy, and it's an abnormal growth of cells in the prostate. If you look here, this is a normal healthy prostate. And then here is a diseased prostate. As you can see here, the prostate itself is enlarged and infected with cancerous cells. But there are early warning signs that we must all be aware of, especially men, being aware of these signs. The first early warning sign is the need to urinate, and frequent urination, especially during the night. You get up and you have to go to the restroom several times. The next one is having the difficulty of an erection. And the next one is blood in the urine or semen. And then the next one is frequent back pain or lower back pain in the hips or the lower thighs. These are all warning signs that we must be aware of. There are 4 stages of cancer, 1 through 4. 1, which is called stage 1 or T1, this is the earliest stage of cancer. And there's a trace of cancerous cells inside the prostate. Stage 2, which is the second earliest, there's definitely cancerous cells inside the prostate. Stage 3, which is known as T3, there are cancerous cells inside of the prostate and also that has extended outside of the prostate. And then stage 4, which is the most dangerous, where the tumor has invaded structures or tissues. At this point, cancerous cells are not only within the prostate, but they have extended outside of the prostate and they affected tissues and areas around the prostate itself. This is the most dangerous and the final step of prostate cancer. And here's an illustration that I have. Here's a normal prostate, and as you can see in stage 1, there's the traces of cancerous cells, and then it progresses to stage 4, which is the most dangerous, where you can see the cancerous cells not only inside of the prostate, but they have extended outside of the prostate and have affected the lymph nodes. There are so many things that you need to know when you have been diagnosed with cancer. The main thing is to learn as much as you can about this dreadful disease. as well as the available treatment that is available to you. The next is research, research, research. Spend a lot of time on the internet researching. There's many treatments that are available to you, and I can tell you personally that research, research, research. The next is get a second opinion. You know, you can go to the doctor and they can tell you that you have prostate cancer, but it's best to get a second opinion with a pathologist or an oncologist who is an expert in this field of study. There are different types of treatment that you need to be aware of, and I'm just going to cover the most popular ones, or the ones that everyone hears about on a regular basis, which is chemotherapy. That is one of the treatments that are available. The next is radiation and or surgery, and then alternative medications and or treatment. Now, these are some of the most popular ones that are known, but there's additional treatments that are available. It's important that you consult with your doctor for the best form of a treatment that is best suited for you. Now, in conclusion, I would like to say that all hope is not lost because you've been diagnosed with cancer. The main thing is that awareness, and also spending time with our doctors and getting our yearly exams. And also, men, you need to be aware of the early warning signs. If you're experiencing some of the signs of prostate cancer, it's best to set up an appointment and go see your physician immediately. African Americans run a risk of 60% being diagnosed with cancer, that compared to other nationalities. So you need to be aware of all the warning signs of prostate cancer. And next is, if detected, get a second opinion. And sometimes a third opinion is necessary. And then last but not least is decide upon a treatment plan. I thank you so much. This is the end of my visual presentation. I pray that all is well with you. And if you have been diagnosed with this dreadful disease, awareness is the key, and also consulting with your physician to decide on a best plan of treatment for you and your family. Thank you so much.